Okay, hello everybody. I'm Brian, and we're here talking about more AAMI news. This time we're celebrating more of the AAMI Fellows class of 2026. I'm here with Bhaskar Iduri, who was not able to join us at AAMI Exchange. He was honestly busy doing what he does best, and then had to leave Exchange early. But that said, we were able to catch up with him today to talk a little bit about the fellowship, but more importantly, the progress of his career and what makes an AAMI Fellow. So, Bhaskar, thank you for joining us today. I really appreciate it. Uh, I'm going to ask you in a second to tell me your current name and or current title over at Sharp. But even before that, I wanted to mention you're a multiple time Emmy Award recipient. You're not just a fellow with us now. Before that, you won a leadership award, and even before that, you were winning some of our publications awards and recognitions. So, very much congratulations. It's a reflecting of an Amy member who's really you got your hands in a lot of cookie jars. So I think that's fantastic, and I want to talk a little bit about it. So, what do you do now? Who are you working with?
First and foremost, thank you, Brian, and the whole AMI team for setting up together and kind of recognizing and all the opportunities, that I have been working for the last, 15 years being in this field. So currently, my role is I'm the IT director for clinical engineering with Sharp Healthcare based out of San Diego, California. So I've been with Sharp for close to 5 years now. Uh, Kind of the same thing, more and more medical device oversight day in and day out. At the same time, their capital lifecycle management and the cybersecurity. So these are all the different areas that currently I'm kind of overseeing at Sharp.
So I love that you mentioned that your focus is now health IT because for those who might know you, you are going to be, you're also a recognized member of our HTM community, healthcare technology management. And a lot of the time when we talk about HTM, people are talking about, clinical engineering or device maintenance or things like that. And this is, I think, something that you and I are going to talk a lot about today, but more
Mhm.
and more so, we're seeing this transition into the health IT area. Why is that? What's going on in HTM that's leading to that inclusion?
Again, I can go back to when I started my whole career in the biomed field, like where you have like a standalone bedside monitors kind of reporting what's happening on the bedside and kind of a central which are kind of overseeing what's happening at the central station, right? But over the period of time in the last 10-15 years, the technology is
Mm.
shifting, right? The standalone medical devices are kind of slowly fading out, and more complex system based kind of monitors or equipment are coming out into the market. It's again going back to patient safety and improving the patient care. So I think that's the core for everything that we do in healthcare. And when you talk about any kind of initiatives within healthcare, we go back to patient safety, patient outcomes. How can it help the day-to-day work that the nursing are doing on the floors, right? So the standalone medical devices is kind of shifting towards this bridge called complex clinical systems per se. So they are able to talk to the network Wi-Fi. They were able to send the data over Wi-Fi. They were able to kind of send alarms to even to your mobile phones now. So that's the
Mm.
kind of technology that we are seeing in the industry now.
So this is
So
a step beyond just
yeah,
electronic health records, right?
yeah,
This is
it's
we're talking about patient monitoring. We're
patient
talking,
monitoring. Yes,
yeah.
exactly. So again, currently, we have this program for almost 2 years now at Sharp, where you can send the patient waveforms on a bedside monitor to a physician's mobile phone, so they can log in and they can see what's happening on the bed on that particular day of time in that
Yeah.
particular room. So that's the kind of place where we are now with the whole shift. So that kind of troubleshooting, like just standalone biomed device troubleshooting, is kind of now evolving into what's happening with network, what's happening with the security, what's happening. So it's kind of multifold, and you need to wear multiple hats when you kind of start digging into investigating what's happening with your equipment.
No, that's for sure. I've heard a lot about this. It's a lot less of a fix-it shop these days. You've
Yes.
got to be able to at least talk to your network engineers. You've got to be able to understand the interoperability of your devices. And something else that was brought up is that at Sharp, you're also working to advance your cybersecurity um,
Hmm.
infrastructure. So I'm wondering is that something that you learned outside of the HTM space, or was it something that you had to kind of adapt to with the changing of the world and
So I think
electronic health records, the
I
rest?
within the HTM, what you call area, like I think if you just look at the cybersecurity in general in the healthcare market, it's already kind of a matured program. At Sharp, we already have things in place. We already have, the leadership, the whole IT team supporting the cybersecurity field.
Right.
So what's happening is, as I kind of mentioned earlier, more and more devices are on network. They are kind of talking to the various systems within the hospital, right? So there is kind of like an uptick, like, okay, what's happening in the biomed space? What's happening in this medical device space that we are not aware of? Should we have some controls in place when it comes to cybersecurity, right? We are buying this equipment, they are connecting to network, they are sending patient data, like, but what kind of railguards do we have to enforce? Like, they are still kind of,
Gotcha.
aligning with the cybersecurity practices that are out there beyond just HTM, right? All the NIST framework, etc., etc., that's all in the industry. So that's kind of like where we started looking at, okay, what should we do in the cyberspace for biomed or medical devices, right? So I think the first and foremost is we need to have visibility. So we need to know what we have out there. We need to know how many devices are connecting to network, right? What's kind of make model they are, what kind of things they are connecting to. Are they talking to a server? Are they talking to some other, outside network, which shouldn't be the case. So these are all the things which are kind of unknown when I first walked into the space. So that's where we started the whole cybersecurity implementation surrounding medical devices. And now we have a first-hand what you call dive deep into what's happening, what kind of equipment do we have, make, model, mix, age, different kind of security controls in our place, etc. So that's kind of what's happening within the cybersecurity surrounding medical devices.
Yeah. And it sounds to me that Sharp is very much on the up and up. They understand the environment and the evolution of these technologies, especially in the case of interoperability, cloud computing, things like that.
Mm-hmm.
Uh, at the same time, though, we do hear that other health systems and other HTM professionals kind of have to justify being at the table or getting their foot in the door when they're working with their health IT teams. Do you have any advice for them on how to make sure that they get that HTM perspective in the room?
I would say, I think in my case, I'm part of IT, so which kind of makes me an value add. But I think what I noticed is you need to have ongoing collaborations, not just with IT, with the network team, with IT team, cyber team, and also your, supply chain for sure. Those are all the kind of ongoing collaborations, kind of, meet and greet with them, start kind of having like a maybe monthly, quarterly check-ins with them, what's happening in the space,
Yeah.
maybe kind of doing a walkthrough to see how the equipment and the network is set up at the hospital. So, which typically, I don't see biomed or HTM spending more and more time in that area, but at least go out there and see what kind of an infrastructure we have there, how they are communicating with these various departments, floors, what they do, etc., and kind of understand the IT part of the process. Like, what do they call change management? What do you mean by this cloud computing? How does it really impact the HTM side of it, right? So I think I would start with collaborating more and more with them. I think everything that currently that we are seeing in the industry, you need to have a collaboration with various departments.
No, I'd love to hear that. And,
So,
collaboration is obviously a big call to action on Amy's side, just because we're a standards developer, and that's what I was hoping to talk about next, because you're also part of and have participated in our work with alternate equipment maintenance and
mhm.
standardizing that entire process. Tell me a little bit about that. Why is that necessary?
I would say, I mean, again, when CMS first came up with this initiative, like, when it comes to the equipment maintenance, you do have flexibility now to deviate from what the
Right.
manufacturer is saying. But that flexibility comes up with a lot of requirements, supporting evidence, documentation, reviews. So there is really no kind of like a
Yeah.
checkbook where it says, hey, this is all the things that you need to meet so that you can go ahead and implement. So that's where I think, as a community, I think, AAMI came up and said, no, we're going to put a task force together. We will try to get different feedback from various healthcare organizations and kind of finally develop a maintenance program on AEM that kind of helps the industry. So I think there is a value in that, especially the good old standalone devices are kind of fading out. We need to find some optimization in the maintenance activities. So definitely, AEM program kind of helps to meet some of those gaps and try to really kind of optimize the time that the biomeds are kind of investing today and kind of shift towards some of these complex systems that are out
Hmm.
there.
There's a
So
challenge there too, of course, which is, if you're stepping away from the script, so to speak, then you're
yep,
also introducing risk. So
yeah.
how do you account for the risk management side of that as well?
I would go back with the data. I would kind of, make sure all my supporting data, what kind of repairs, repeat repairs, the age of the equipment, yep, we have deviated from last year, but we have not seen any kind of uptick in the repairs, or we are not seeing any kind of adverse events with the equipment. It is still functioning as it's supposed to be. So
Yeah,
I would back up your approach when it comes to AEM with the supporting solid data contributing to it. So
that's fantastic. Yeah, I 100% agree. You know what, Beskar, we were listing your accolades before, and you're obviously proving that you're very I guess you're in the know, right? And that seems to be a really important part of your job is staying up to date on how these technologies are evolving and changing. You're collaborating. Um, I'm curious how you do so, right? So if you were when you're talking to both your peers on the health IT side, but also the HTM side, is there specific ways that you're keeping your eye on how things are changing in the field and then saying, hey, this is something we need to keep the eye on in our hospital, et cetera?
I mean, I would say one of the things that I always look out for is the AAMI news, right? So I mean, I've been part of contributing to AAMI for such so long, being in the field. So I always look for kind of the articles that are coming out there, case studies, white paper, what's happening in the industry. I think that would be one of the things that, if you want to kind of look at the evolution within the HTM program, I think
Sure.
AAMI news kind of following like what's happening is really critical.
I
Along with,
love to hear that, but
yeah,
yeah, feel free. I didn't ask him to say that,
no,
everybody.
no, I mean,
But
I
anything
think
else?
that's
Yeah.
how, what's happening outside, right? I mean, we are
Yeah.
so busy doing on day-to-day activities, getting the prints in line, getting the projects lined up, making sure everything is kind of meeting the needs, but you also need to be keeping up with the changes, right? I think change is kind of an evident. You need to kind of be prepared for it. So I think some of the readouts that AAMI is putting together, or even some other, organization like HIMSS, ACCE. So those are all the things that I would kind of look for, like, hey, what's happening? Where is the technology kind of shifting towards?
Now, you mentioned ACCE. It is worth mentioning that you are the incoming president for
Yeah,
ACCE. Is that correct?
yes, I'm the president-elect for
Yeah,
ACCE now.
President-elect.
Yep,
Congratulations. Now,
thank you.
what kind of work then? We should talk about that. Are you going to try to focus on with ACCE moving forward?
I mean, we are kind of a lot of what do you call parallel workforce that are happening within ACCE with the whole collaboration with AAMI, right? How we can kind of expand our territory beyond just AAMI, kind of
Oh
having
yeah.
across the world, getting the name out there, kind of getting that HTM view, like I think those are all the kind of work that ACCE is kind of putting together, and some of the uh, what do you call the right to repair kind of work that is happening out there, and I think the initiatives that are happening. So these are all the some of the things that we are doing with within ACC.
Oh, that's fantastic to hear. Bhaskar, it's been really cool to kind of learn a little bit about your perspective and journey. Before we hop off, I did want to ask you, is there any last bit of advice or last call to action that you'd like to share with the AAMI membership specifically to maybe even encourage them to also seek a fellowship, something like that?
I would say, I think, I mean, AAMI has tons of material that is available on the website. I mean, there are a lot of workforce activities that are happening, either standards development, newsletters. So I would kind of, keep doing the same initiatives that are happening across the field. I think it is important. That's how you get more and more people to look at what's happening out there and try to register and kind of sign up for it, and kind of have a readout to it and say, hey, I want to go back and contribute, right? How can I do that? So I would kind of, encourage doing more and more, what do you call, like the webinars, the AMI exchange, which is really great. That's something that I always look forward to attending to, kind of meet with the people, the fellow leaders, all the other colleagues in the industry. At the same time, the whole technology, right? I mean, some of the uh, programs that I'm seeing at the exchange recently, they are incredible. I think the technology, the kind of equipment they are bringing to the shows, I think you don't get to see them in a
Yeah.
hospital. You need to go out and kind of be in this kind of sessions and exchanges.
That's wonderful to hear. Often when we talk about conferences, we talk about the value of the collaboration
Yeah,
and the coordination between peers. But at the same time, yeah, there's new ideas on the expo hall floor for anybody to
yeah.
just kind of stumble across. So that's thank you for sharing that. And thank you for joining me today to talk a little bit about this. Once again, this is Bhaskar Iduri, class of 2026 AAMI Fellow. And thanks so much for joining me.
Thank you. Thanks, everyone. I appreciate the opportunity. Bye.
Awesome.